Hello and welcome back to Zoology 141 online. Today's lecture is going to be on the skeletal system, specifically covering the axial and appendicular skeleton. And by the end of this class, of course, I expect you to be able to recognize all of the 206 bones in the human body, but I don't expect you to recognize all the holes, the processes, the fossa, and so on. We're going to reserve that type of evaluation for the laboratory class and the lab practicum. So for today, you should concentrate on learning the bones, learning what limbs or what parts of the body the bones are found in, and also being able to classify the bones as either axial or appendicular. So as we said last time, there are two divisions to the skeletal system, the axial skeleton and the appendicular skeleton. The axial skeleton is basically anything that is in a straight line, and it includes the skull, the vertebra, the ribcage, and so on. And so all the bones that you see here in blue are part of the axial skeleton, and there are approximately 80 bones that are in the axial skeleton. So the axial skeleton, as the name implies, is an axis or line that helps to be the central support for the body. It also helps to protect various body organs, right? We talked about the rib cage is helping to protect the heart and the lungs, and the cranium is helping to protect the brain. The axial skeleton is also very important as a site of muscle attachment. One of the things we talked about in the last lecture were those spinous processes that we see on the vertebrae. And remember, anytime you see a spiny or pokey process, it's usually going to be a site for muscle attachment. So at the very top of the axial skeleton, of course, we have the largest group of bones, which is the skull. The skull is composed of 22 bones which fall into one of two divisions. The cranial bones, which form the brain case, and the facial bones, which, as the name implies, form the face. Now these bones tend to be very different in their structure and also in their size. The bones of the brain case, that is the cranial bones, tend to be fairly thick. Even though they're flat bones, they tend to be fairly thick and impervious because the job of these bones is, of course, to protect the brain. Whereas the facial bones tend to be much thinner and much more delicate and much more easily injured than the cranial bones. So we're going to start out our examination of the skull by looking first at the 8 different cranial bones. Remember, the cranial bones protect the brain and also house the inner ear ossicles. These are the bones of the inner ear that help us to transduce sound. We'll talk more about those when we get to the sensory system, and for now we're going to concentrate on the big bones that protect the brain. And so these include things like the frontal bone, the parietal bones, the temporal bones, the occipital bone, the sphenoid bone, and the ethmoid bone. So let's start out with the frontal bone. As the name implies, this bone is found in the front of the skull, so you should never get this wrong on a practicum. It is a single bone, meaning it's not divided into two, it's just one big bone, and it's also a bone that's very thick. We have a lot of compact bone on the outside and a fair amount of spongy bone on the inside. We also have something in there called frontal sinuses, and a sinus is just an internal cavity that is both a resonation chamber for the voice, and it also has some mucous membranes. And the main function of the frontal is to protect the front of the brain, the frontal lobe, where the personality is located, and also reasoning. And it's also a very important attachment site for some of the jaw and neck muscles. For example, the temporalis muscle has a slight attachment to the frontal bones and also to the parietal bones. If we take a look at the lateral part of the skull, we can see 2 bones, that is paired bones, called the parietal bones. The parietal bones are just in back of the frontal bones, that is, they're dorsal to the frontal bone, and they make up a very large part of the dorsal part of the cranium. The parietal bones are connected to the frontal bone by something called the coronal suture. A suture is a special type of joint attachment that we'll talk about in the next lecture. So while we're on the subject of the cranial bones, we should talk about a defect or disorder of the cranial bones that is called anencephaly. Basically, this name literally means without head or without a brain. And so anencephaly or anencephalic children result when the cranial bones don't completely fuse during embryonic and then fetal development, and as a result the cranial vault is left open during pregnancy and much of the brain is atrophied and wastes away, and so we usually have a fetus that is stillborn or dies very soon after birth, and if they have any brain whatsoever, it's usually a rudimentary brainstem. And so this is characterized by a defect in the cranial bones where they don't completely close over. The next cranial bone is something called the temporal bone. As the name implies, the temporal bone is found in the temporal region. And this is a very important bone because it protects the side of the head, and it also forms a joint with the lower jaw called the temporomandibular joint. The temporal bone is a very complex bone. That is, it's a bone that has several different parts. The largest part of the temporal bone is something called the squamous part. And squamous here just means flat. So the majority of the bone here is part of the squamous part labeled A. And the squamous part is much thinner than the other cranial bones. For example, it's much thinner than the frontal bone. So if you get a blow on the front of the head, let's say with a flashlight or something like that, the frontal bone is fairly sturdy and impervious, whereas the squamous part of the temporal bone is actually very fragile. And the squamous part is an area where the temporalis muscles will attach, and these are very powerful muscles used for chewing. If we take a look a little bit further down in the temporal bone, we see something called the zygomatic process. The zygomatic process is a part that sticks out and is moving towards or connecting to the zygomatic bone. The zygomatic bone is the cheekbone, and we'll take a look at that in just a few more slides. Now below that we have something called the external acoustic meatus, and this is just a fancy term to mean it's an opening into the middle ear and later internal ear. And so as sound waves are conducted into the head through the external ear, the pinna, they move through the ear canal and into the external acoustic meatus and eventually reach the middle ear, where that sound will vibrate the tympanic membrane, and those sound vibrations will be transmitted onto the inner ear, which helps to transduce that sound and convert it into nerve impulses. And the last part we have here that I want to point out is something called the mastoid process or mastoid region. This is an area where we have a lot of alveolar bone, and it's a prominence that is important for a site of muscle attachment. The muscle that attaches here is something called the sternocleidomastoid, and this is a muscle that helps us to bow our head, and it also helps us to turn our head from side to side. The occipital bone is a cranial bone that makes up the majority of the inferior part of the skull. And it's a very important bone, and what you probably notice already is there's a very large hole in that bone called the foramen magnum. Remember, a foramen is just a hole, and this is just a very big hole here that allows the passage of the spinal cord into the cranial vault. To the sides of the foramen magnum we have two bumps which are called the occipital condyles. And the occipital condyles are important sites of articulation with the first cervical vertebrae. Remember that the word articulation just means where two bones connect or rub against each other. And so usually a condyle is a nice rounded articulation that allows movement between these two bones. And we'll talk more about this when we get to the chapter on joints. Another feature that's on the back of the occipital bone is something called the external occipital protuberance. And this is just a very big bump on the back of the head that allows for the attachment of various neck muscles, for example the trapezius. So the last two cranial bones are bones which are not very easy to see from the outside of the skull, but which are nonetheless very important to the function and structure of the cranium. And one of these is called the sphenoid bone. The sphenoid is sort of the keystone bone of the cranium. That is, it forms the base of the cranium and it connects with several different bones. The sphenoid sort of looks like a bat or a biplane to me, and it has two different important regions. The top part is something called the lesser wings, are a very small set of bony prominences. These lesser wings are only visible from inside the skull. That is, if you were to cut around the cranium and remove the frontal and parietal bones, you could see them inside the cranium, but you won't see them on the outside. Lateral and inferior to the lesser wings is a much larger set of bones called the greater wings. The greater wings, as the name implies, are much larger, and they're also visible from the outside of the skull. So on these skulls at the top of the screen you can see two pieces of bone that are illustrated in green. These are the greater wings of the sphenoid. There's a couple features of the sphenoid that you should be familiar with. First of all is something called the optic foramen. The optic foramen allows the passage of the optic nerves into the orbit. The optic nerve is the nerve that supplies the eye. The other thing you should be familiar with is a depression in the top of the sphenoid called the sella turcica. And the sella turcica is a cavity that houses the pituitary gland, which is a very important endocrine gland. And finally, you should notice the pterygoid processes which issue off the ventral part of the bone. The pterygoid processes are important sites of muscle attachment for the muscles of the jaw. Okay, and our last cranial bone is the ethmoid bone. The ethmoid bone is almost completely obscured by the facial bones. And so the ethmoid bone is located in between the eyes, and if we were able to pull that ethmoid bone out, you can see that it kind of is variegated, and it has the look of, to me, like a shucked walnut. And so important features of the ethmoid bone include something called the perpendicular plate. The perpendicular plate is a vertical sheet of bone that makes up the superior 2/3 of the nasal septum. The nasal septum is basically just that sheet of bone that divides the nasal cavities into the left and right halves. And so the superior two-thirds of this nasal septum is made up of the ethmoid. Now, other important features of the ethmoid bone include the middle and superior nasal conchae. These are also called the turbinate bones, and the function of these bones is to create turbulence in the inhaled air as it comes in the nose, and because they're covered with mucosal epithelium, this turbulence helps to trap particulate matter in the mucosae, and it also helps to warm and moisten the air as it's inhaled. And this is important because if you're breathing really cold, dry air, that air has the potential to damage the very delicate, simple squamous epithelium that's in the alveoli of the lungs. So the job here of these turbinate bones or nasal conchae is to warm and moisten that inhaled air and also trap any particulate matter that might be in there. Okay, so while we're on the topic of the skull and the cranial bones, we should talk about the sutures that join these bones. And a suture is an immovable joint that is only found between the bones of the skull and the cranium. And the most easy to recognize suture is something called the sagittal suture. Remember that the word sagittal means to divide into left and right halves, and so the sagittal suture divides the left parietal bone from the right parietal bone. Another highly visible suture is something called the coronal suture. The coronal suture separates the frontal bones, which are anterior, from the parietal bones, which are posterior. And I like to remember this like, if you get in a barroom fight and somebody hits you with a beer bottle that happens to be a corona, this would crack your head from left to right, creating the coronal suture. And finally, the last suture visible here is something called the lambdoidal suture. The lambdoidal suture separates the occipital bone from the paired parietal bones. Now, in the last slide, we said that sutures were basically immovable junctions between adjacent cranial bones. But it's important to realize that these sutures haven't always been there. That if we look at a newborn or a neonate, they don't have these sutures, and the bones themselves are not yet fused together. What we find instead are something called fontanelles. Fontanelles are membrane-filled spaces between the adjacent cranial bones that are found in the heads of fetuses and infants. So initially, these fontanelles remain unossified and therefore allow movement between adjacent cranial bones. And this is important for two reasons. Firstly, think about the size of the human head. The human head, particularly the head of a fetus, is a lot larger in proportion to the rest of its body, and it's certainly larger than any other group of primate. And because we have such a large head, it makes it very difficult to get the child through the birth canal or the vaginal opening. And so these fontanelles allow just enough movement between these cranial bones to squeeze the head a little bit and force it through the birth canal and allow a normal vaginal birth. Now, if you've ever seen a neonate or a fetus soon after birth, you realize this because you see oftentimes they have a little bit of a cone head. Now, the other thing that these fontanelles do is it allows for very rapid growth of the brain during infancy. If we had a fused cranium at this point, it would be very difficult for this brain to grow as quickly as it does. So by having fontanelles between the bone, it allows the cranial vault to expand very rapidly. And once that expansion's happened, then we start to see ossification between those cranial bones and formation of these sutures. Okay, now that we've looked at the cranial bones, we're going to switch gears and take a look at the facial bones. The facial bones are the bones that have no direct contact with the brain or the meninges. They do support the teeth, and they also give shape to the face, and they form part of the orbital and nasal cavities. And they also provide sites of attachment for muscles of facial expression and mastication, which just means chewing. So there are 14 facial bones, and these include the nasals, the maxillae, the zygomatic bones, the lacrimals, the palatine bones, the nasal conchae, the mandible, and also the vomer. Okay, the superior-most set of facial bones are known as the nasal bones. And as the name implies, the nasal bones make up the upper third of the bridge of the nose. And the nasal bones are paired bones. They're also very delicate. And so if you get a blow to the bridge of the nose, this can very easily fracture the nasal bones, which will probably require surgical repair. Okay, just ventral to the nasal bones is a group of bones called the maxillary bones, or maxillae. And the maxillae are very important bones because they are the bones of the upper jaw. So these are paired bones that, in their ventral aspect, have teeth in them and make up the anterior two-thirds of the hard palate. The hard palate is just the roof of your mouth that you feel that is hard and it has ridges on it. If we look at the anterior part of this bone, we also see that it has two very small pores in it, which are called the infraorbital foramina. And these are passage sites for both nerves and blood vessels that supply the face and the upper lip. So just lateral to the maxillae is a pair of bones called the zygomatic bones. The zygomatic bones make up the lateral part of the orbit, that is the hole where the eye sits, and they also make up our cheekbones. And so think about how important cheekbones are. They're important not just for areas of muscle attachment, but they're also important for giving our face structure and symmetry. So think about what types of actors or actresses might have very prominent zygomatic bones. For me, one actress that comes to mind is Cher. Cher was formerly a musician and then became an actress and now is more of a political activist, but she does have very prominent zygomatic bones which give her cheeks some very nice structure. Now, people, of course, aren't the only mammals that can have very nice zygomatic bones. If you're more into animals, you might like this next picture. This is a cat. To me, it looks like a Siamese cat. And as you can see, it has very prominent zygomatic bones. And remember, the zygomatic bones make up the lateral part of the orbit, that is the area where the eye sits. And they're also important for allowing muscles of mastication to run underneath them and connect up to the temporal bone. And so there is a process coming off of the zygomatic bone called the temporal process. And the temporal process connects with the zygomatic process of the temporal bone. If this sounds confusing now, don't worry about it. This is something that's better learned in lab and not discussed too much in lecture. For right now, all you need to know is that the zygomatic bone is a facial bone. It makes up our cheekbones, and it also makes up the lateral part of the orbit where the eye sits. So another facial bone that is very hard to see is something called the lacrimal bone. The lacrimal bone is best viewed in a lateral view of the skull and is located just inferior to the frontal bone and anterior to the ethmoid bone. And the lacrimal bone is important because it makes up the medial side of the orbit. The other thing that it does is it has a special duct in it that allows for passage of tears from the eye into the nasal cavity, and that's called the lacrimal duct. And the act of lacrimation is actually crying. And so next time your kids start to whine or cry about something, you can say, "Shut up and quit all that lacrimation," or "I'll give you something to lacrimate about." Okay, looking inferiorly now at the skull, another group of bones that make up part of the hard palate are called the palatine bones. And so, like the maxilla, the palatine bones are important for making up part of the hard palate. The first 2/3 of the hard palate were made up of the maxillary bones, that is the bones of the upper jaw. The last third of the hard palate is made up of the palatine bones. So while we're on the subject of the hard palate, we should talk about some disorders that affect it, and one of these is called cleft palate. Cleft palate is caused by a lack of fusion between the palatine bones and sometimes the maxillary bones, and basically it allows a passageway from the oral cavity up into the nasal cavity. And think about why this might be a problem. Well, one reason is because when an infant is suckling or breastfeeding, this can allow aspiration of fluids from the oral cavity up into the nasal cavity. And these fluids can in fact make their way down to the trachea and down to the lungs, where they can cause something called aspiration pneumonia. And aspiration pneumonia can actually be a very life-threatening disease to a newborn. Another thing that cleft palate does is it usually causes something called a hair lip, which we can see here on the right-hand side of the screen. So the hair lip is disfiguring. Kids obviously would be teased about it, and so most often we want to do a surgical correction for that. In the United States, it's very common to do a cleft palate surgery. There's whole journals of work devoted to looking at the most efficient way to repair a cleft palate. Despite the surgical repair, people that do have a cleft lip surgery will usually have a small surgical scar as a result. Can you think of any actors or actresses that may have had a cleft palate at one time? Our next group of facial bones are called the nasal conchae or nasal turbinate bones. Now, if you were paying attention a few slides back, you probably remember that I already talked about turbinate bones in association with the ethmoid. And that's true, the ethmoid does make up a couple of the turbinate bones. However, the inferior nasal conchae or inferior turbinates are made up of facial bones. And like the other two bones, they help to create turbulence in the inhaled air and basically serve as reverse radiators. They moisten and warm the inhaled air, and they also help to trap particulate matter and their mucosal epithelium. Okay, our next facial bone is the mandible, and the mandible is the strongest bone in the skull, and it's also the only mobile one. So the mandible is the lower jaw, and its job is to chew up and masticate food. And just like the upper jaw, we have teeth in the mandible that help with that mastication process. And of course, if our job is chewing, we have a lot of bony protuberances or processes that help to connect to the very powerful jaw muscles. So the lower jaw or mandible contains some specific anatomy that you're going to need to know in greater detail for the laboratory course. First of all, let's take a look at the largest part of the jaw, and this is called the body of the jaw. The body of the jaw is the part that actually holds the teeth, and those teeth are secured very tightly in alveolar bone by something called the periodontal ligament. Another feature of the body of the mandible is something called the mental foramen. The mental foramen is a passageway for blood vessels and nerves to exit the lower jaw and innervate or supply the tissues of the lower lip and also the chin. Posteriorly, the mandibular ramus marks a 90-degree turn in the bone of the mandible. The ramus has two processes. Anteriorly, we can see the coronoid process, which is an insertion point for the very powerful temporalis muscles which are used for mastication. Posteriorly, we can see something called the condylar process. The condylar process is an articular process. That means it's going to articulate with another bone. And specifically, the condylar process of the mandible articulates with the temporal bone to form the temporal mandibular joint. These two processes are separated by something called the mandibular notch. Now, just like we had a cranial bone that was barely visible from the outside of the skull, we also have a facial bone that is barely visible, and that bone is the vomer. The vomer is also sometimes called the plowshare bone, and this is a bone which is completely obscured by the hard palate, but it's only visible if you're looking in through the nose, and it makes up the inferior 1/3 of the intranasal septum. That is the bony plate that helps to divide the nasal cavity into left and right halves. Okay, before we leave the cranial and facial bones, we should briefly mention sinuses. Sinuses are basically hollow cavities within bone, and we find them within the ethmoid bone, the sphenoid bone, frontal bone, and also maxillary bones. And so these are cavities that are lined with mucous membranes and open into the nasal cavity. And these sinuses basically serve two purposes. One is they help to lighten the skull, that is, make it less heavy. The other thing is they serve as resonating chambers for the voice. That is, they give the voice its particular timbre and pitch that we normally have. And you don't normally think about this until your sinuses are stopped up. Let's say you have a cold or an allergy or something like that. And then how do you sound?
Well, if you're like me, you sound very funny. You don't have the same timbre or pitch to your voice, and that's because the sinuses have been occluded with mucus. But as the sinuses drain, the mucus will drain, and eventually
you will get your normal voice back. And so while we're talking about sinuses, we should also mention something called sinusitis. Remember, the suffix itis means inflammation of, and so sinusitis is basically an inflammation of the mucous membranes within the sinus cavities. And of course, this can cause headaches and pain and discomfort and so on. And so that's why one treatment for sinusitis is taking a decongestant. So that completes our survey of the bones of the skull. We're now going to go on and talk about other bones of the axial skeleton. And the first of these is a very unique bone called the hyoid bone. The hyoid bone is a U-shaped single bone that lies inferior to the skull. It is attached to the upper part of the larynx. Now, this is a very interesting bone because it is a bone that articulates with no other bone in the human body. That is, it's suspended by cartilage, but it's not touching any other bone. And the function of the hyoid bone is to support the tongue and also provide attachment site for muscles of the tongue and neck, and also some of the pharyngeal muscles. Now, the interesting thing about the hyoid bone is this is actually a remnant from a primitive gill arch which was created during the embryonic period. And the other thing you should know about the hyoid bone is this is the bone that's most frequently fractured when somebody is strangled. So if you take a look at a season or two or CSI, this will come up at some point where somebody has a fracture in the hyoid bone, and that means usually some digital pressure has been applied to the larynx and that somebody has been purposely strangled. So if you ever strangle somebody, take care not to bruise the hyoid bone. Okay, now that we've covered the bones of the skull and also the hyoid bone, we're going to move on to talk about the backbone or spine, which is made up of vertebrae. And so the vertebral column is composed of 26 vertebrae, which are divided into 5 different regions. And the first vertebrae we find are the cervical vertebrae. Cervical here means neck, and so these are the vertebrae that make up the neck. So in total there are 7 cervical vertebrae, and one thing you'll notice is they tend to be very, very small. So this is a point that I want you to think about. Anytime we see lots of very tiny bones, it usually means that we're going to have a lot of flexibility, but maybe not a whole lot of support. And so think about how mobile and flexible the cervical region of the body is. Now think about you can jut your head forward or backwards or make it go around in a circle, and so the neck is an area that is very, very flexible. On the other hand, it's also a very delicate area. Think about whiplash and other injuries like that. The neck is very, very prone to injury because it's made up of tiny bones that allow for flexibility, but they also don't protect us very much from injury. So in the last slide we said that the cervical region was made up of 7 very tiny vertebrae that allow a lot of flexibility. Now, our neck is pretty short, so I want you to think now about the neck of a giraffe. A giraffe has a very long neck, and so I want you to think about how many vertebrae do you think are in the neck of that giraffe. So think about it, write it down, and then go to the next slide. Well, the correct answer here is 7. Giraffes have 7 cervical vertebrae. And what this means for a giraffe is that these vertebrae cannot be small like they are in us, but they tend to be very large. The vertebrae themselves can be greater than a foot in length. And so what this means is that the giraffe, in fact, doesn't have the flexibility that we'd have, or at least proportionally it doesn't have the flexibility. So if you take a look at what happens when a giraffe bends down to eat something, it's like one big armature coming down. The neck doesn't have nearly the amount of flexibility that ours does in proportion to its length. Inferior to the cervical vertebrae, we have the thoracic vertebrae. The thoracic vertebrae are the vertebrae that make up the back of the thoracic cavity, that is the area that houses the heart and the lungs. And there are 12 cervical vertebrae in total, and the way that you can identify them is that all 12 of them connect via transverse processes to the ribs. And so if you look down, you see a vertebrae that's touching a rib, you know for a fact that that is a thoracic vertebrae. So inferior to the thoracic vertebrae are the 5 lumbar vertebrae. And the lumbar vertebrae are much larger and also sturdier than the thoracic vertebrae. And this is because their job is to support the weight of all the overlying structures, the thoracic region, the cervical region, the skull, and in fact everything that's in the upper body. However, even though these vertebrae are very sturdy and strong, if you know anything about back pain, you know that more frequently than not, you tend to get an injury to the lumbar region of the spine. And in most cases, this isn't because the vertebrae themselves have been damaged, but that the vertebral discs that separate these vertebrae have been damaged, and therefore it causes a lot of pain. And so we'll talk more about vertebral discs here in just a minute. So the last 2 regions of the vertebral column are the sacrum and also the coccyx. The sacrum, which is shown here in green, was in fact once thought to be the seat of the soul, and that's why they called it sacrum. And of course now we know that it's nothing but the seat of the pants. Still, the sacrum is very important. There's a lot of nerves that move through there. In addition, the sacrum is basically the attachment point of the axial skeleton onto the appendicular skeleton. So the sacrum and also the hip bones or coxal bones form a very important joint called the sacroiliac joint. Now, inferior to the sacrum is another group of vertebrae called the coccyx or coccygeal vertebrae. And this is made up of 4 or 5 fused vertebrae. And the coccyx is basically your tailbone. Now, all vertebrates start out embryonically with a nice postanal tail, but in old world monkeys and, of course, ourselves, that tail becomes regressed during embryonic development so that we're born usually without a tail. Now, that said, there still are functions to the coccygeal region. Coming off the coccyx are a number of ligaments that help to support muscles which support the pelvic floor. Another thing that you should know about the coccyx is, even though it doesn't extend beyond the body, it still can be bruised or broken. If you've ever known somebody that's landed hard on their butt, you know that you can bruise the coccyx or even break it. In that case, it becomes extremely uncomfortable when you sit down. And so usually these people have to sit on that little donut-shaped pillow, which is quite embarrassing. So while we're on the topic of the vertebral column, I should mention that in lab I'm going to expect you not only to recognize which region of the vertebral column I'm talking about, but also be able to identify specific vertebrae within each vertebral series. For example, I should be able to say to you, point to C2, and you should know that C2 is the second cervical vertebrae. And so you have to be able to identify these vertebrae, but also know how many vertebrae are in each series. And one mnemonic device that I learned when I was taking anatomy was to think about what time you eat meals. For example, I'm an early riser, so therefore I eat breakfast at 7 o'clock in the morning. 7 for 7 cervical vertebrae. And I usually eat lunch right around noon or 12 o'clock, 12 thoracic vertebrae. And finally, because I'm an old dude, I tend to eat dinner very early, around 5 o'clock, 5 lumbar vertebrae. Unfortunately, I don't know of any mnemonics to memorize the number of sacral vertebrae or also coccygeal vertebrae, so you just have to memorize that the sacrum is made up of 5 fused vertebrae, and the coccyx is usually made up of 4 to 5 fused vertebrae. So in summary, there are 5 groups of vertebrae that are divided into 4 curvatures. These include the cervical curvature, consisting of 7 vertebrae, the thoracic curvature, consisting of 12 vertebrae, the lumbar curvature, consisting of 5 vertebrae, and the sacral curvature, consisting of 5 fused vertebrae. The normal curvatures of the spine are probably best viewed from a lateral view. overall the spine has an S shape with a concave cervical and lumbar curves and convex thoracic and sacral curves. These curvatures increase the resilience and flexibility of the spine, allowing it to function much like a spring and absorb excess energy and impact. So in the last slide we talked about normal curvatures of the spine, but as you probably are aware, we sometimes also see abnormal curvatures as well. The first of these is a condition called scoliosis. Scoliosis is characterized by a pronounced lateral curvature of the spine, which primarily affects the thoracic region. This condition is most prevalent among adolescents, particularly females, and is usually treated with corrective braces and/or surgery. The second disorder is something called kyphosis. Kyphosis is characterized by a dorsal deviation of the thoracic spine, and this is often caused by osteoporosis or osteomalacia. As a result, we have somebody that has a hunchback appearance. And finally, lordosis or swayback is an abnormal ventral curvature of the spine. This is common in people that are carrying more weight than normal up front, for example, guys that have pot bellies or beer bellies, and women that may be pregnant. Now that we've had an overview of the vertebral column, we're going to specifically take a look at vertebrae in general and learn about the different parts and processes. And the most important part of a vertebrae is called the body. The body is the central weight-bearing portion of the vertebrae. That is, one vertebral body lies on another vertebral body, and these two bodies are separated by intervertebral discs. And as we'll talk about in a minute, these discs help to cushion and absorb a little bit of the shock between the vertebrae. Now, superior to the vertebral body is something called the vertebral arch. The vertebral arch you can think of as being sort of like a tent that surrounds and protects the spinal cord. And so it has a couple different parts. The pedicels here, meaning feet, are basically the sides of the tent, whereas the lamina is the top thin part of bone that makes up the top of the tent. The cavity created by the vertebral arch is called the vertebral foramen. And the vertebral foramen, of course, is the site where the spinal cord would be located. The arch in general helps to protect the spinal cord from injury. Located adjacent to the vertebral arch are 7 very important vertebral processes. Remember, a process is something that sticks out, and basically processes can be divided into 2 categories. Now, sometimes these processes are going to be sites of muscle attachment, and other times these processes are going to be sites that articulate with or touch other bones. And so the first of these processes we have are the transverse processes. The transverse processes extend from the side of the vertebrae, sort of like wings on an airplane. And if we look at the transverse processes of the thoracic vertebrae, these are going to be the processes that articulate with the ribs. Now, above the transverse processes, we have something called a spinous process. The spinous process is a vertical sheet of bone, which is a very important site for muscle attachment. And finally, towards the front and back of the vertebrae, we have something called articular processes. Articular processes are just processes which help to connect adjacent vertebrae to one another and also help to share the weight and give the spine some structure. So in the last slide we showed a very generalized picture of a vertebrae that was probably from the thoracic region of the vertebral column. Now we're going to look at 2 very specialized vertebrae that are found in the neck, and that is the atlas and the axis. Now the first cervical vertebra, C1, is called the atlas. And if you remember back to your Greek mythology, you'll remember that Atlas was the guy who was commanded by Zeus to carry the world on his shoulders. And that's basically what the first cervical vertebrae is doing. But the world here is the weight of the skull. The skull is a tremendously large structure, and it can be very heavy. And so the atlas is designed to carry that weight, but also allow some flexibility. So take a look at the atlas. First of all, you'll notice that there's no vertebral body to speak of, and then off to the sides of the atlas are 2 very important shallow depressions called the lateral masses, and on the lateral masses we have these depressions called the facets. Now, these articular facets are sites that will articulate with the occipital condyles of the occipital bone of the skull. And this is important because it does allow some mobility for the skull. That is, we can nod our head yes up and down, but it still bears the majority of the weight of the skull. Now, inferior to the atlas is a vertebrae called the axis. So the axis here is the second cervical vertebrae, and it also is very specialized in structure. You notice that it also has facets off to the left and right side, but it also has a very peculiar protuberance that looks like a penis to me, and that's called the dens. And the dens is important because it allows the overlying atlas to rotate around the dens when somebody shakes their head no, but it still holds a connection between the atlas and the axis. So now that we've talked about the skull and also the vertebral column, we're going to talk about the last component of the axial skeleton, and those are the ribs. The ribs form a nice bony cage around the very important organs of the heart and also the lungs. And so we're not just talking about ribs here, but also things called costal cartilages, and those are the cartilages extending from the ribs, as well as the sternum. So there are a total of 12 ribs in the human body, and these number of ribs don't differ between males and females, so forget the biblical stuff about Adam giving up his rib to create Eve. Both males and females have a total of 12 ribs. So the first 7 ribs are called the true ribs, or vertebrosternal ribs, because they extend from the vertebrae in the back all the way to the sternum. And so these ribs connect directly with the sternum via their costal cartilages. And these cartilages are there for a little bit of sponginess and flexibility. They don't really move per se, but as you breathe in or breathe out, there's a little bit of elasticity there that gives a little bit of give in the thoracic cavity. Now let's take a look at ribs 8 through 12. We call these our false ribs. And the first few of these ribs are called vertebrochondral ribs. And that's because their cartilages don't directly connect with the sternum. Instead, they connect with the cartilages of the overlying ribs. And finally, the last 2 ribs are called floating ribs because they're attached to the spine, but they don't attach to the sternum or the cartilages whatsoever. Now, one way you can remember the number of ribs is that remember the number of thoracic vertebrae. There are 12 thoracic vertebrae, and so we must have 12 ribs because by definition, all thoracic vertebrae articulate with or connect to ribs. And so there are in fact 2 different connections between the rib and the vertebrae. The first of these is something called the head. The head is the proximal most part of the rib, and it connects with a facet on the side of the vertebrae. The next part of the rib, found distal to the head, is something called the tubercle. Now the tubercle here just means bump, and this is a bump that articulates with the transverse process of the thoracic vertebrae. So at the anterior part of the rib cage we find the breastbone or sternum. The human sternum is divided up into 3 parts. These include the manubrium, the body, and the xiphoid process. The manubrium and body are primarily made of bone, whereas the xiphoid process is initially made of hyaline cartilage. However, in people over 30 or 40, this tends to become fairly ossified, and it also becomes very delicate. And so if you've ever taken a CPR class, you probably already know all about the xiphoid process. The reason is that it's a very delicate bone that can be easily broken, and if it's broken during chest compressions, this can cause massive, life-threatening lacerations of both the heart and the liver. And so this is the reason why they tell you to find the xiphoid process before starting compressions, but then to start your compressions superior and lateral to the xiphoid.